What's number one obstacle to post-operative foot and ankle recovery? Uh, in my experience, it's post-operative weakness and deconditioning. It's something that people don't think about, both patients and frequently surgeons, and definitely must be addressed, especially if you are able to do it before surgery. Many lower extremity surgical procedures, especially those involving bones and joints, require prolonged immobilization or at least limitation in walking and activity to allow for proper bone healing. You don't want to break that bony bridge that's tentatively held in place by screws and plates or other types of modalities and have to start over and do revisional surgery. We humans are designed to move, walk, and explore, and surgery, of course, temporarily restricts that, um, get in the way of our drive to move. Movement that is generally allowed after surgery involves the use of equipment, one that is likely not familiar to you. This equipment could put other parts of your body, like your shoulders, your back, neck, other muscles in your body, on strain. For example, using crutches or cane or knee rolling walker or even a wheelchair may need to happen for you to allow for proper offloading. You may need to be able to balance on one foot. When's the last time you tried to stand on one foot? You should probably try it right now, see if you can do it. And then try again to see if you can do it with your eyes closed. What if you have to get up in the middle of the night to use a bathroom or go to the kitchen for a glass of water while knowing that you cannot put weight on that foot? How well are you able to accomplish this task? This is a difficult task, and even for the most motivated people, if it is to be done correctly, not to compromise the surgical site. Um, so imagine yourself, struggling with this now when you don't have foot pain, when you don't have post-surgical foot pain. But what if now you are dealing with bandages on the foot or ankle? You are dealing with pain. You are taking pain medication, which may make it difficult to concentrate for you. How are you going to do it? And this is why I highly recommend a visit with the surgeon many months prior to your surgery date to discuss the details of the surgery, as well as post-operative recovery protocol for your specific procedure. So once you know what's expected, you can start getting ready with concentration on specific activities that you need to do, and even maybe training specific muscle groups that are going to be helping you in the recovery process. This is not unlike training for a marathon. Obviously, if you're planning to undergo foot surgery, you are likely at this point unable to wear comfortable shoes. That's why you're seeking foot surgery. Probably can't walk or stand on or run for a prolonged period of time, but that's okay. Ask your doctor to refer you to formal, trained physical therapist to work on balance, stability, gait training with recommended offloading modality that the doctor is expecting you to use. Train on performing safe transfers, in and out of the chair, in and out of bed, um, in and out of a car, climbing stairs, carrying a bag while not putting weight on the foot or whatever restriction your doctor has on you. Those are much easier to do and train for while you are waiting for surgery rather than after the surgery is completed. You know, uh, concentrate concentrate on things that you could do to reduce the swelling. What can you do to increase upper extremity muscle strength, core strength improvement, endurance improvement? Um, if you're going to be completely non-weight bearing, can't put any weight on the foot, expect yourself to get weaker. Because if we don't use the muscles and we don't use the bones, those do get weak. So prevention is the best medicine here. Physical therapy is not covered by your insurance, especially in the setting of getting it before surgery. Shop around and consider paying out of pocket if you can for a professional physical therapist or personal trainer, maybe at the gym, at least 1 or 2 sessions. Maybe that's all you really need to get yourself started. As long as your surgeon is very specific in his or her instructions on what muscle groups to train and what to do, you can take that paper, that order to the physical therapist or personal trainer, and they can get going with you on getting you stronger, getting you ready. Go with clear set of expectations and a list of specific questions that you want to discuss to maximize the time during the training session. Maybe bring a friend who can do a video recording for you of this training session, who can take notes, because it's probably going to be a lot of information. And going back and watching a video of recommended exercises and reviewing the notes could be of great help, so you can repeat these over and over and over until your surgery date is happening. I do not recommend just looking at videos online or reading articles online on how to prepare for a specific surgery, as individual assessment from a trained specialist definitely would provide the best possible outcome for you in light of your overall health, your whole lifestyle, the way your house is set up, the way your health is, what you can and cannot physically do and accomplish, prior injuries, all of that needs to be assessed, discussed, and a tailor-made plan must be formulated for you to succeed. A proper modality must be selected, considering your strengths and weaknesses, including crutches. Are you strong enough? Are your shoulders strong enough? Can you be in a fracture boot, or do you need to be in a cast or a splint? You know, there's so many things that, so many minor details that can be caught before surgery even starts, even happens, that could help you succeed. So hope you find this information helpful. Like and subscribe if it does. Share with your friends, and I'm going to be sending more um, videos like this to you that will hopefully help you be ready for surgery and will help you prevent negative negative outcomes, which is not fun for you, and definitely not fun for your surgeon, because your surgeon always wants you to have a successful outcome and return to activity and enjoy your time. Take care.